All right, today we are tackling a really important topic: fluid volume deficit. We're going to get into what happens when the body's reserves start running dangerously low. And to really kick things off, I want to share this quote from our source material because, man, it just paints a picture. Clients present sucked in, shriveled up, and very weak, like a dried out raisin in the sun. Just picture that for a second. That's a powerful image, right? It really hits home just how serious this can be. So here's how we're going to break it all down. First, what happens when the body runs dry? Then we'll look at the four main culprits. We're going to decode the 3 Ds, you'll see what I mean. We'll check out the body's alarm system and then wrap it all up with a memory kit to help you lock all this in. Okay, let's dive right into our first section. When the body runs dry, what are we even talking about? Let's define fluid volume deficit. Okay, so what is it? Fluid volume deficit, or FVD for short, is really just a way of describing dehydration. It's pretty simple. The body's in a deficit. It's lost more fluid than it's taken in. Sounds basic, but believe me, the implications are huge. And hey, here's a super simple memory trick to make sure that sticks. Just think of the word dry. D for dehydration, which means you have a deficit of fluid. See? Dry. Easy, right? Okay, let's build on that. All right, so if FVD is the problem, then what's actually causing it? Let's play detective here and uncover the 4 main culprits behind this fluid loss. So we've got these 4 big categories. First up, urination, and something I'm calling the 3 Ds. We're going to dig into that one a lot more in a second. Then you've got severe burns. The fluid loss there can be absolutely massive. Third, a hot body and sweating. Think fever, heat stroke, that kind of thing. And finally, the ones we probably all think of first, vomiting and diarrhea. Those can dehydrate you so fast. Okay, remember that first one, urination, and the 3 Ds? Well, that one's the most complex, so we're going to give it its own section. It's time to decode the Ds: diabetes insipidus, diabetic ketoacidosis, and diuretics. Let's get into it. All right, the first D we're tackling is diabetes insipidus, or DI. The key thing to know about this one is that it's all about losing huge amounts of water through your urine, and, this is important, it's got nothing to do with blood sugar. And here is the absolute best way to remember it. Just think DI equals dry inside. I mean, it's perfect, right? The body is just pouring out water, leaving you totally dry on the inside. So simple, but man, it works. Okay, on to our second D. Diabetic ketoacidosis, or DKA. Now, this one is all about high blood sugar. It's a really serious complication of diabetes, totally different from DI. So what's going on here? Well, that's super high blood sugar, hyperglycemia. It literally starts pulling fluid out of your cells. An infection is often the trigger for this whole cascade. And on top of that, people can get this really deep, rapid breathing called Kussmaul respiration. And that breathing alone causes you to lose fluid that you can't even see or measure. It's a double whammy. And just like before, we've got a simple memory trick. With all that fluid getting pulled out and lost, for DKA, just think, D is for dry. Easy. All right, our third and final D is a little different. It's not a disease. It's a type of drug. Diuretics. You've probably heard of them as water pills. They're designed to make you pee more, usually for things like high blood pressure or heart failure. Yeah, some of these names might ring a bell. Furosemide, hydrochlorothiazide, they're super common, and they're great at what they do, getting rid of excess fluid. But, sometimes they can be a little too good at their job, and that's when you can end up with fluid volume deficit. Okay, now check this out. This is such a great clinical pearl. Notice the names: furosemide, hydrochlorothiazide. They both end in "ide." So the memory trick is awesome. Drugs ending in "ide" can make the body dried. How cool is that? So when your body starts losing all this fluid, it doesn't just give up. Oh no. It's got this amazing built-in alarm system, and it starts fighting back. Let's take a look at how the body tries to compensate for this. So what happens? Well, first, the most obvious thing. Your brain starts screaming, "Drink water!" and you feel thirsty. At the same time, your kidneys get the message and they go into conservation mode. They hold on to fluid, which is why urine gets darker and more concentrated. And then, to keep your blood pressure from tanking, your heart starts pumping faster and your blood vessels tighten up. It's a really smart response, but you can tell it's the body's last-ditch effort to keep things running. Whew, okay, we have gone over a lot. So let's pull all the best bits together into your personal FED memory kit. This is going to be your go-to for remembering all this stuff in a snap. Ready? Recap number 1. Diabetes insipidus. DI is drier inside. Next up, diabetic ketoacidosis. DKA. D is for dry. And finally, those diuretics. If the drug ends in "ide," it's going to leave the body dried. And boom, here it is, all laid out for you. This is the ultimate cheat sheet. You've got the condition, the key thing to look for, and that memory trick all in one place. It really doesn't get any clearer than that. Okay, so to wrap this up, I want to leave you with a question. Now that you have this whole toolkit, we've talked about the body's big, loud alarm bells. But what do you think is the earliest,